Assalamu alaikum. Good afternoon. Thank you for all those who are present over here, and especially the coordinators of this one health and exhibition. Thank you, and of course to my boss, Mr. Ranil Abraham, who gave me this opportunity. My name is Vijay Nair. I am from AIIMS Pharmacy, managing pharma division with AIIMS Pharmacy. So thank you, Dr. Nadia, for giving a lecture on best practice, and Dr. Evraj for challenges in the manufacturing issues and his vision up to 2040, and Dr. Julanda for best pharma in pandemic, and of course a fireside chat from all the three officials. And towards the last but not the least, I am going to tell about a topic called micronutrients. We know nutrients are very much required for our day-to-day life and for a healthy life, everything I am told. So regarding micronutrients, when we hear the topic or hear the subject, and in the beginning itself I would like to tell you that I don't like to tell a big speech. I would like to have an interacting section, so that when you people are interacting, things which you forget, you will remind it, and of course I will also get something from you all. Thank you. So when we are hearing about nutrients, something is striking to our mind that it is about carbohydrate, proteins and fats, because normally we know for a healthy way to, yes please, we know for a man or for a lady or for a human being to have a healthy life, they must be having all the three things in a proper form, like carbohydrate, proteins and fat. So we may be also thinking only after consuming all these only our health will be better, and we may complain to the doctor when we are taking our child, doctor, he is not eating properly, he is very thin, he is very lean, or something to make his body we need. So that time we are just thinking about, oh, we have to give him good carbohydrate, good time, and protein, fat. But these are three is categorized as macronutrients. So in addition to the macronutrients, we have a special group of food is called micronutrients. So micronutrients itself, it is saying it is to be given in a micro quantity. Okay, so we'll see what exactly micronutrients telling about. Yeah, so generally micronutrients comes in two categories, vitamins as well as minerals. See, we can see what are the importance of this micronutrients in our life. So micro, it is itself showing us micro quantity, but they are having a vital role for overall health in a small quantity. Okay, then what they were exactly doing in our body, they produce essential enzymes, hormones and substances for normal growth. So many a times we are just giving an ignorance to that thing. Okay, no need to take a micronutrient, what it will be, what it will do for our body, but we have to take a good quantity of macro. But don't give a clear attention to the dosage of micronutrients in our body. When you are giving those things in a required quantity, our health will be in a better case, and many of the fatal diseases we can avoid. So they play a certain role in maintaining the hemostasis. What do you mean by hemostasis? Anybody can say? Hemostasis means it is giving a correct temperature control to the body. So it will be having a correct pH, the blood sugar and temperature. So these are the things which are called homeostasis. So the presence of micronutrients will make the body in particular homeostasis. So for our body, we need a homeostasis condition. If it is changing, different kind of disease can happen to the body. You know, for when the temperature is changing, we may say it as it's fever. Okay, when the sugar is fluctuating, we can say it as diabetes. So these are the main consequences regarding homeostasis. Okay, so next slide please. Okay, so we told micronutrients including two categories, vitamins and minerals. Normally vitamins are 13 vitamins available. We know very well that vitamins can be broadly divided into two categories, fat soluble as well as water soluble vitamin. B complex and C include water soluble vitamin, and A, D, E and K includes fat soluble vitamin. So this comes under 13 vitamins. And next we can say minerals. This is around 16 minerals. So these two comes together as micronutrients in the body. So in this 16 minerals, Three of them we can categorize as macro minerals and trace minerals. Macro minerals include potassium, calcium and magnesium. The rest all belongs to trace minerals. So now in this 30 vitamins, water soluble vitamin, we are saying vitamin C, B1, B2, B3, B5, B6, B7, B9 and B12. Anybody know about one vitamin called B8? Vitamin B8 is simply telling us inositol, or it is called myoinositol. It's a very important vitamin required for the neurotransmitter function. This is also used for those ladies who are having PCOS. Okay, PCOS, and those who are, actually this is a byproduct coming from glucose. It is of course it is not a glucose product, it's a byproduct coming from glucose. It is calling as myoinositol. So it is very much important for those obese lady who are having pregnancy. In those case there will be a chances for diabetes. To avoid that one, we are giving this one, of course also for PCOS. Okay. Then just see the daily recommended allowance for all these vitamins. So it depends on the sex, I mean men, women, and for the age type, and of course the upper limit which shows that in the cases of diseases, when the disease is more, we may have to give a correct quantity of micronutrient. That's why it is called a not defined. But all the others are, these are the main recommended dietary allowance to be given for men and women during all the life stage, everything and all. So whenever we are approaching to a doctor will say, okay, we will write vitamin, but many of us may deny this, or no need vitamin, we are having a good food, but it is no. See, why we will be having a question, why we are giving vitamin as such? You know why it is so? Because we are having a good kind of food, meat we are eating, fish we are eating, milk we are eating, egg we are eating, all the vegetables, everything we are having, but there is a issue for getting the right vitamin, right quantity. You know why? Vitamins, to convert it from the, when we are digesting, when we are taking food, from that food, vitamin should be converted into a good form, then only it is absorbed by the bloodstream, then only it will reach the required place. But when in a diseased case, or we are in an old age case, all the body organs are in a tired form, they will not get the right energy to convert the vitamin from the in taking food to the respective site. That's why we are giving it as a vitamin itself. You got the point, no? Okay. So let me see. So all these things, you see, the nutrients are giving in the form of nanogram or milligram. That's why it is called a micro level. We are not giving in a gram 4 or something like that. So very low quantity is required for the body to maintain all the normal lifestyle. That's why it is called a micro. Then we'll see the role of, next slide please. The role of microvitamins in the body. See, just see the slide, it's very well explained that the deficiency of all this vitamin. See, B vitamin mainly, this is having a problem in weakness and fatigue. Of course, B complex vitamin is, when pregnancy is detected, what the thing which we are giving first? B complex only. Then of course, and folic acid also. These are the two things which we are giving in the beginning of the pregnancy. So those things we very much required for the neural tube defect. Nothing should happen bad for the growing embryo. So we are giving those things in the beginning. Then next one, vitamin A, D. These are the, these need to be normal growth, especially in children, bone function, then immune function. This is vitamin C, D, E, minerals, zinc and selenium. These are the main thing which is for the infection, regulate immune response. Then the combination, for the bone health, calcium plus vitamin D, magnesium and vitamin K. So whenever we are approaching a doctor with some ortho issues, everything and all, we must check the content of calcium in the body, vitamin D. So many of the time doctors are prescribing vitamin D form, and the strength is only in international unit. It is not like a gram form. That's also a micronutrient. So doctor will say 10,000 international unit to be taken once in a week time. You got the point, no? So why such a combination is required? Actually, bone health, we may say that normally vitamin D is necessary or calcium is necessary, but the combination vitamin D, magnesium and potassium, this combination will make the calcium to the required site of the bone where there is a deficiency is happening. So all the combination will work in a better way than giving single form. Cal D3, you know the preparation available in the market. So these are the things. Then okay, then the next one is called blood health. So which are the main micronutrients required? Iron, folic acid and vitamin B12. We know in Oman most of the marriages are happening in the interior from the same family. So this will be giving a problem like this will be causing a problem like thalassemia, G6PD. So these are the main issue for the disease to happen. It's called a genetic disease, we can say. So in those cases, these I mean the early stage itself we have to be detected and these kind of micronutrients to be given. Then last there is one cognitive and neurological function. Cognitive means see the items which are required is folic acid, B12 and certain traces elements. So cognitive means correct thinking is not happening. We will not have a proper thinking. We will be confusing. So these are all because of the vitamin deficiency, B12 deficiency especially, as well as folic acid deficiency. So just this very clearly it shows that these are the indications or these are the problem with the lossage or deficiency of all these micro minerals. Hope it's okay. Yeah, next please. Now we know, so we have already discussed that what are the deficiencies in the previous slide. So we know when there is deficiency, normal things which are happening is anemia, goiter. The goiter mainly due to iodine deficiency. Then rickets, scurvy, pellagra, beriberi, and vitamin A deficiency, serophthalmia. So these are the main things which deficiency which leads to this kind of fatal diseases. If we are not treating, this is going to a very big danger. So if we know, see iodine is required for our normal healthy life of thyroid gland. So what form of iodine we are taking as a thought process? You people can say about this one. Iodine is incorporated into which food? I know, salt. Iodized salt, that's the best, yes. So that's why everybody, doctors are recommending take iodized salt. So with that one, because iodine with salt is normally we are putting in all curries and preparations. So that's the best way to have iodine deficiency, to avoid iodine deficiency. That's it. Okay, so we saw the deficiency. So I told already in the beginning that it required a micro level. So why it is taking in a more quantity, that is called overdosages. So the toxicity symptom can occur. Vitamin A, if you are in higher quantity, see already vitamin to be taken in international unit only in all the preparation, micronutrient preparation. But if you are taking a more quantity, it may leads to severe liver function problem, liver diseases, and to damage to all iron also. If taking in more quantity, it may cause damage to other organs also. Okay, so excessive intake is also a fatal case, and we have to take only the right quantity which is required, mentioned in the RDA. I have shown in the beginning recommended dietary allowance, and that way only it is to be taken. But in the cases of diseases, as the doctor can say that you have to take, diabetes is one of the case where there is a high lossage of all the micronutrients are happening, like zinc, magnesium, selenium. These are and of course selenium and zinc is also very much required for the proper reproductive organs functions, like correct healthy sperm and healthy ovum. Everything is to be happen. We need to take those kind of preparations. So that's why for every kind of healthy lifestyle, we need all these micronutrients. And we may also has to know that there are some diseases which cause the lossage of micronutrients from the body. For example, like gastrointestinal infections. So that's why in those cases we are going to take antibiotics. So why doctor is writing vitamins in the same time? Because of this issue. Because of this gastrointestinal problem, so many micronutrients will lose from the body. So doctors are prescribing antibiotic. With that one they are writing vitamins also. And other infections like HIV. Yeah, HIV is one of the big infection where we can lose micronutrients. Then hepatic damage, then kidney damage. All these are the main issues which cause this lossage of micronutrients. Okay, although all these cases we have to have a proper intake of these items. Now we will see, next slide please, the common deficiency which is happening in Oman regarding. So we know very well that anemia, blood disorder, is one of the main reason which is happening. Around 27 to 30% of, and say it's a close covering study happened among non-pregnant women. Those women during the reproductive age and also in children. 27 to 30% they are having this anemia issue. And iron deficiency, of course, 24.8%, and vitamin A. And among this, the vitamin D is also comes to a better percentage, 16.2. But compared to other Gulf region, nearby Gulf region, Oman is in a moderate balanced state. So Saudi and Kuwait are having higher percentage of vitamin D deficiency. We know vitamin D, how come it is happening? See, most of the time we people are remaining inside the AC room only. So vitamin D should happen in the body from sunlight only. So we have to utilize some of the time outside to get the vitamin. So, but the conversion also may be not happening properly. That's why doctors are prescribing vitamin D accordingly. And of course, folic acid and B12. These are the stages. This the survey happened in 2016-17, and now also soon after COVID cases, post-COVID cases, vitamin D deficiency is more happening. So now more patients are there who are depending on vitamin D preparations. So vitamin D, see, when we are approaching a doctor with some sort of pains in the joints and body, some doctors are very clearly saying that you go and check your vitamin D. The vitamin D deficiency is one of the main reason which can cause this kind of issues. Okay. So why the factors, mainly the deficiency which is happening in Oman? See, we can see dietary pattern, then sunlight exposure, then fortification of gaps. That means I said one of the things that iodine with salt is one of the best example. Then cultural, socio-economic factors, health status. Then in Oman, the locally available foods, we know how we are taking these kind of micronutrients from the food. We know the normal items which are available: fish, of course, dates, dairy, milk, egg, meat, and vegetable, fruits, and even though these much kind of foods are available in Oman, in locally, in everywhere, and it can be consumed to get the correct quantity of all these micronutrients, but we are in a setup to export this to other countries, and also enough quantities not available for the people to have in mainly in the urban area and all. So there are those who are depending on this kind of activities like in their daily life on something, and they are making these items and then exporting to other countries, and although proper intake is not happening. So that's what I want to ask Dr. Nadia, whether a clear study or clear awareness should happen to those kind of urban area with the PHs related doctors and all, so that they will be having an idea with these are the food to be taken in a right proportion, right quantity. Something can happen. Is it is happening like that through PHC? Okay.
Dietitian part.
Correct.
And actually, they have their own schedule of having community awareness and all those things. As I know that in each health center, even in the rural areas, we have dietitian whose responsibility is making her patients or the community she has aware about the nutrients and how to eat properly and what is beneficial. And even in the time the patient is diagnosed by diabetes or diagnosed by malnutrition, they should give them the advice needed and how to eat.
Actually, doctor, what I am thinking is in the capital area, most of them are educated. They know how to go with the proper schedule. But in the urban area, there are also these G6PD cases, thalassemia and iron deficiency issues are happening. Why? Because of the, if I am wrong, please correct me. Because the marriage is something, it is happening in that way also, from the same family. So there, through the help of a valley officer, it's just a thought process, I don't know how far it is. With the help of a valley officer who is ruling over those area, through the PHC, some of the things are, teams are coordinated, and they will be giving the right education. It can come up to a better level, because woman is now in a better position than those. I am here for the last 25 years. With that experience, I am just saying this one. So in this case also, they will be getting more educated regarding the issues and what are the things to be done. So such kind of things can happen. No, and it's a regular survey. That's what I am thinking. Yeah. Okay. So then, next we can see Oman with the neighbor countries. So in this case, we can say Oman is in the trivial prevalence, it is compared to all other Gulf countries. Oman is having a lower prevalence in vitamin D deficiency as well as other issues, and Saudi is having a better percentage, as a more percentage regarding these issues. So that's why Oman is out of 5.5 million population, now they are coming, Oman is coming to a better, very good level than the previous day. Okay, so that's what regular and continued education in the urban and those kind of capital, rural areas, it can come up into a better level. Because there, people, those who are having this kind of issue through any disease, they will not report properly, and they will not visit the hospital to get diagnosed and get the better treatment. That's the only thing which we are. So next one, here what are the steps which we can adopt, what exactly needed to counteract all these issues. Up-to-date national survey, and survey should be happening not only for vitamin D issue, we must know for iron issues and vitamin B12 deficiency, vitamin A. So cross controls, study for all these, collecting the blood samples of all these from all these areas, and we have to have a clear picture what exactly is happening. And of course, now we are mentioning only about pregnant women and non-pregnant as well as kids, but we have to extend it to other preschool children also as well. Then standardized method cutoff of getting the data, vitamin D, biomarkers. Then the data of dietary intake, proper dietary intake, among the available items like fat, fish, milk, meat and all, whether they are taking the right quantity and they are getting enough for their day-to-day life. That also, whether it is happening or not, that also can be analyzed accordingly. And as I mentioned before, after COVID-19, more infections are very much prone to happen without, in limited time periods, only because of the vitamin C issue. So that's why doctors are telling vitamin C should taken by most of the, everyone. It can be one 500 milligram vitamin C daily is must required for boosting the antiviral activity. So if more vitamin C is available in the body, it can boost to get a infection from virus also. So I must say that not only considered our macro foods like fat, protein and and carbohydrate, we must have a clear idea about the things which is happening in the body regarding the deficiency of these micronutrients, and proper health checkup should be done by all the people, even in the capital setup as well as in the urban area, so that their body level with all these trace elements can be identified, whether it is in the dietary elements it is available, or if it is not there, it should be given proper treatment to save their life from fatal diseases. That's the only thing. Anything else? Any question?
One question I have.
Yeah, please.
You talked about the vitamin B8.
Yeah.
And I didn't hear that actually.
Yeah.
And is it available in any product?
Yes, very good question. Vitamin B8, I told it is ionositol, or we can say it as myoinositol. So I said what is the main usage over this neurotransmitter issue, and giving a signaling for insulin in the body. So accordingly, so why it has been, okay, this has been introduced in many preparations, which is mentioned for ladies who are having this polycystic ovary issues. Okay, doctor is trying to treat it with 1 gram myoinositol daily. There is a product available in the market called